Where is the vaccine? Why are more people not getting vaccinated? When can I get in line? These are just a few of the many questions being asked this week by Rochester residents. Our Alex Tejada spoke to a Mayo Clinic physician to try to shed some light on this confusion. Alex.
Caitlin, by the end of January, Rochester healthcare professionals expect priority groups 1 and 2 of 1A will be vaccinated. That still leaves 1A3 for February, all while a rollout plan for a more complicated group is prepared, 1B. It was a complicated plan even before any obstacles arose.
We're entering what may be the toughest and deadliest period of the virus. We must set aside politics and finally face this pandemic as one nation.
Newly inaugurated President Biden wasted no time doing just that today.
Our national strategy is comprehensive. It's based on science, not politics. It's based on truth, not denial, and it's detailed.
Rochester residents hoping it means more vaccine doses coming to the Med-City.
We have a lot of capacity. We have the machinery, we have the site, the people, the processes, the procedures. What we don't have is vaccine.
Mayo has the capacity to vaccinate up to 50,000 people a week, yet the whole state is only receiving 60,000 total. And limited supply is not the only issue.
Our deliveries are coming on a later day of the week, kind of each time.
With priority group 1B next in line for the vaccine, the group has been expanded, now including 65 and older instead of just 75 years and up. Dr. Swift is afraid for those who need it most, despite a new pilot vaccine site coming to Rochester beginning Thursday.
And my concern is that those vulnerable people will have the hardest time accessing vaccine if it becomes wide open and a highly competitive process. We really have to readjust and think about how we can do it equitably.
And she warns not to believe anyone that claims they can move you up in line to receive the vaccine.
No one can do that. Don't fall for it. Please, if you do hear anything like that, please report it to Minnesota Department of Health.
Dr. Swift says Mayo Clinic here in Rochester is prepared to vaccinate non-patients that are eligible as well. She says Mayo is scheduling around 1,700 appointments a week, much less than the 10,000 they could currently have capacity for if there was enough vaccine in supply. And as I said, the pilot program began today to continue to vaccinate Minnesotans. Our Barrett Leone was there and has more from those who made the cut for today's first doses. Barrett?
Well, Alex, vaccinations for Minnesotans over the age of 65